I think you're really going to enjoy this episode. We have Mai Tran, who's the Director of Sales, Marketing and Education at Harbor Compounding Pharmacy in Costa Mesa. They focus on hormone replacement and many other interesting topics. Libido, hair loss, anti-aging, very, very informative.
Yeah, I really loved her, and I will be ordering a few things today from Harbor Compounding. Let's just say that. What they're doing with sexual health, I just thought is going to work out great in the office, and she was lovely and so informative.
Yeah.
It's a great episode. Enjoy.
Yeah. But what do I know? I'm just a vagina doctor. Mai Tran, great to have you on the Vagina Doctor podcast. Thank you.
Thank you so much for having me. Pleasure to be here.
So you're previously director of Harbor Compounding, my absolutely favorite pharmacy, compounding pharmacy. You're now the director of sales and marketing and education for that company. We've been involved with each other for more than a decade. You've been my go-to pharmacy for all compounding things. We'll get into more detail of that, but just give us the history of Harbor Compounding and what your goals are and what you're accomplishing so far.
Yeah. So basically, when I started at Harbor Compounding in 2010, so that was about 13 years ago, right? And when Harbor started, we were a small compounding pharmacy business, one of many in the field at that time. But then as the industry has evolved, things have, the industry has changed. So back then, there was mainly, the compounding industry was mainly focused on hormone replacement therapy, which is great, which is the bread and butter of the compounding pharmacy industry today. Well, I mean, there are many main focuses, but hormone replacement therapy is one of them. Another main focus is veterinary medicine, which there are several compounding pharmacies that focus on that. But our focus was basically hormone replacement therapy. But as the technology has evolved, as wholesalers for our ingredients, as they develop their inactive ingredients, we've been able to develop more and more products that can help patients more than just hormone replacement therapy. We've been able to personalize it. So we're delving more into like dermatological preparations, gynecological preparations, just mainly things that are formulations or ideas that have been developed in clinical studies, in small clinical studies, like sample size is less than like 50 or 100 people.
Yeah.
And they found it's effective for them, but it never went through a full FDA approval, a full FDA trial to get it pushed into market. So then here at our compounding pharmacy, we've been researching these products, researching these formulations, seeing that they're working for a subset of people and developing it for, our patients. And so it's been expanding in a really great way. The industry as a whole, regulations wise, also has changed dramatically as well. I mean, the FDA and the boards of pharmacies are looking at us more closely, which is a good thing because they're looking out for patient safety, correct?
Yeah.
So it's definitely created more requirements for compounding pharmacies to exist, to survive. But that has also been really difficult for pharmacies to stay in business. And so we've seen a lot of our fellow compounding pharmacies having to shut down their compounding pharmacy business or their department. Like I just heard about like a pharmacy in Pennsylvania that, had to shut down their compounding pharmacy business as of November because they can't keep up with the rules and regulations that the FDA and the Board of Pharmacy has placed for them. And that's really that's really frustrating for their patients. Can you imagine being told like, hey, in 2 months, we can't service you anymore? How about no one can service them in that particular state? That's really tough for our patients.
Can I interrupt for just a sec?
I have a question too.
Just for our viewers that may not be familiar with the term compounding pharmacy, can you just sort of briefly explain what's the difference between you I won't make it too difficult, and CVS. Okay.
Yeah. So we call the pharmacies, the retail pharmacies that are typical, like your CVS, your Walgreens, your Rite Aid, commercial pharmacies or commercial retail pharmacy, meaning that they don't make the products or your drugs from scratch. They don't make it from individual ingredients that are coming in. They basically, source it from a pharmaceutical manufacturer and then resell it to the patient. So that's your commercial pharmacy. But your compounding pharmacy, what you're doing is we are taking a prescription that a doctor, a prescriber has specified individual doses for patients that are not available at a commercial pharmacy. And then we're making it from scratch. It's kind of like you go to In-N-Out and you get your burger, one way, right? That's the only way you can have it. But how about you need to have your burger done with, turkey or tofu or pork and then you need to have arugula instead of, plain lettuce and heirloom tomatoes. That's what we do. We personalize it for the patient as long as it doesn't copycat something that is already on the market. So that is the restriction.
Okay.
Hopefully that explains it.
Yeah. No. Well, does it explain it to you?
Absolutely. And then I had another question about what you said about the pharmacy that closed. What is the thing that's the deal breaker for that pharmacy that has to close? Meaning, is it
great question?
Is it the cost of something, or is it maintaining? Sustaining? What is it?
It's a variety of factors, right? So back then, 10 years ago, when I was director of pharmacy operations, 90% of compounded medications were covered by insurance.
Okay.
But then now, when I did reports, just like, just last month, only 10% of compounded medications are covered by insurance. So what does that, that means, the demand for it would fall, right? Because patients have only so much dispensable income to spend on these, spend out of pocket for the medications. So, if push comes to shove, they're going to go for your commercially prepared medications at your CVS and Walgreens. Number two, the other, pressure that's come down is the regulatory pressures. So the FDA and boards of pharmacies have been slowly increasing requirements on what the environment in which you could compound, rules like, the requirements for garbing up, gowning, putting on protective equipment, making sure the building is, equipped correctly for compounding, which they're all great, but it costs a lot of money. It costs maybe half to $1 million to set all this up. And how many compounding pharmacies can, hang with that? So that's another tough, decision they have to make to consider to keeping the compounding pharmacy department alive or not.
A lot of the compounding pharmacies previously have really literally been little backroom places in otherwise private pharmacies. And there wasn't much regulation for them, as you said, and they weren't doing very much volume. And to me, other than your customer service, and I'm looking at customers, both patient and physician, other than those benefits that we have, you deal with high volumes, relatively high volumes, a lot of testing, a tremendous consistency in products, and creativity to personalize certain things for certain patients. And believe me, with the hormone replacement therapy patients that I have, they can be very specific at times. So that seems to me that what separates you from the rest, from the other pharmacies. So what's happening is good because they're being sorted out, the good from the bad, the large from the small. But is there going to be, are you going to be able to sustain that? Are you going to be able to keep in place? Because it sounds to me like the FDA are trying to stamp you all out.
Mm-hmm. Yeah.
So, when we were talking the other day, prior to this chat now, you mentioned a book, Good to Great. Jim Collins' book. I'd forgotten about it, actually. And I see that I went back and thought about that after we talked. And I looked at, okay, what was the difference? What was he saying in that book of how do good companies get to great? And they have to be trying to be the best. They've got to do the same thing over and over and over again. They choose their MO. And the hedgehog study, or the hedgehog analogy of every time the fox was trying to kill the hedgehog, it would roll itself in a ball, which worked because the fox couldn't do anything. And that's what kept hedgehogs alive, or they wouldn't be there. And so that repetition, the 20-mile march, which is a phrase that I love from the book, that you do have to do the same thing over and over and over again. And it seems like that's what you're doing. But get into the area of patient care, because customer service generally, when I call a pharmacy, I'm on hold for a long time. If I ever get to talk to any, well, actually, I rarely get to talk to anybody. I usually have to keep a message or I get hung up on. And this is taking me 10, 15 minutes in a busy day to do that. And that's not the way it is with Harbor Compounding. So you're doing a lot of things right at this point. I can always talk to somebody. But what other things make you great? Is it creativity, or is it just the reliability that you're there, or the customer service? What makes you so good?
When we talked about, the book From Good to Great, that when I read that, that resonated a lot with me, because it talked about, one, what makes great companies great. And it's not about the product, actually. It's not about their processes or their technology. It's actually about the right people in the right seat. And, that is like the crux of everything. It's because the people bring upon the ideas, bring up the values, bring up, the innovation to implement, these new technology, to implement great customer service. Because where did we get our great customer service from? It's our approach that all of us, decided that we don't want to be the pharmacy where patients and prescribers are going to be on hold for over, 5 minutes. So we have a policy now. Like, we have a policy in place 10 years ago, actually, not now, but like back then, and it still is today, that you'll never be on hold for more than a minute. You'll always reach someone in under a minute. That's our rule. And
okay.
if we ever, if anyone's on hold for longer than that, then we have an issue. Like, that needs to be addressed right away. Is it more personnel that we need to bring on board? What is it that we need to fix? And it's that idea of continuous quality improvement. Anything that falls apart, that doesn't match our goals, match our principles, we have to fix it. We're just not going to shove it underneath the rug and look the other way. That's, I believe, that what makes us great. And I know that, we want our fellow compounding pharmacies to follow that as well, because, if the entire industry can, rise, then we all rise together, right?
Mm-hmm.
And I wish that concept not only applies to pharmacy, but in medicine, pharmacy at CVS and Walgreens. It's really sad for me to hear, that my, family and my friends, when they go to CVS and Walgreens, they tell me oh man, I was like, they didn't even counsel me. I was on hold for 15 minutes. Can you help me? I'm like, I'll help you. But, we need to be able to help each other anywhere. And
right.
I hope that, we can be that role model, hopefully, where everyone can follow us in in that aspect. Yeah.
I also, when we were talking the other day, I also talked about you doing other regular medications out of not just compounded medications. And you said to me that the reason why the products that you deal with in that way are associated with the hormones, for instance, that you're not going to be there for antibiotics or other things that are unrelated. So yes, we can get other things from you, and that are the hormones are the focus. I previously on the podcast we've had T.S. Wiley and Julie Taguchi. Two people that have pushed bioidentical hormone replacement therapy in the medical scene to the patients in the case of T.S. Wiley, to the patients in the way of Julie Taguchi, who's I work with very closely here. There are other things that you've been creative with, but maybe if we go back to the start that Harbor Compounding had with estradiol and progesterone creams, there are a lot of confusing descriptions, words that are used to describe hormones and where they come from. There's patients want something that they say is natural. Okay, they want it plant-based. They want it not synthesized by a pharmacy. Well, you're not going to get bioidentical without and all of those features together. It's got that phytoestrogen has got to be changed biochemically to a bioidentical. And of course, pharmaceutical companies have no desire to get involved with that because there was no money to be made. They couldn't patent anything until the idea came on as a patch, and their technology went into the patches and they had a product. And now there are a lot of bioidentical forms of estradiol, available through the regular pharmacies. But it was started by you guys. I mean, it's by the compounding pharmacy. You were the only people that were providing it for a long period of time. But now there are other things that you're putting out there in the realm of hormones, or perhaps more specifically sexual medicine, of creams, and to increase libido, increase sensation. Tell us a little about the products that you have for patients in that regard.
Yeah. So, for libido, you and I know, Dr. Turner, that, hormones, if we optimize hormones, that is the foundation of good sexual health. But if you need some additional help, we've dug through some clinical research and we found oxytocin vaginal gel, like in the strength of like 400 to 600 units per milliliter, 1 milliliter vaginally every day, can help boost patients' libido by innervating, increasing that sensation along the vaginal tract. Like, I've had really good responses from patients all over the nation who've tried it. And I had one patient who told me, like, she was 60 and she said that she's never felt so great along, like that sensation was so, it was so optimized. It was like when she was in her 20s. She literally told us, you guys need to patent this and sell it like hotcakes. And I was like, I'll try, I need your testimony too.
Yeah.
But that has been a game changer for a lot of women, especially women who are afraid of using estrogen vaginal cream.
Absolutely.
For whatever reason.
Yeah.
Oxytocin vaginal gel works really well. We've had patients who use testosterone nasal sprays to help boost their libido, boost their ability to attain an orgasm. So that's also important as well. And it's also important to remember when we talk about like sexual health for women that, for men, it's a lot easier, right? It's like a physical thing. Like, can you have an erection or not? But for women, it's a multifaceted condition. There's, um, do you have like desire, your mental desire, right? Is it anxiety in your way? Also, do you have the appropriate lubrication, right? And lastly, do you have sensation and the ability to orgasm? So it's so many different things that needs to be addressed at once. And so we have been able to create products that have been able to address, um, each of these individual uh, conditions of female sexual health. And the last one that I'm going to mention that helps significantly with the hypoactive disorder, meaning the ability, they don't have that much sexual desire, is oxytocin sublingual
Mhm.
tablets or oxytocin nasal spray, because oxytocin, what we know is it's like, the love hormone, right? The
Right.
bonding hormone. And studies have shown that when you take oxytocin, it reduces anxiety. It's been shown to improve patients who have social anxiety disorder, to improve their ability to gaze and connect with other people. And this is very important because if you have anxiety, you will not have that desire to connect on an
Mm.
intimate level with anyone. So let's take that down a notch using oxytocin without using like Xanax or any type of benzodiazepines, right? And with oxytocin, you can connect with other people not only on an intimate level, but also being able to make connections at work, like being able to like really empathize with each other. I've had a patient who told me, who was on it for 2 years, and coincidentally, I was counseling her. I knew she's been on it for a while, and coincidentally, I was counseling her, and I was like, it was the beginning of November. I remember this distinctly because of the story that came out of it. And I asked her, you've been on this for 2 years already. Like, how do you like it? And she told me, she's like, this product saved my life. And I was like, okay, like, can you tell me more? And she said, um, I have kids, and normally my kids don't invite me over to Thanksgiving dinner, but for the first time, I've got invited, and I'm so excited. And I was like, wow. And she's like, I was like, why do you think that happened? And she's like, because now I can see people and I can smile and I can connect, I can relate, I get what's going on with them, and I can empathize. And that just blew my mind away,
Yeah.
that her end result was her ability to connect with her kids and getting,
Wow.
turkey with them.
I have a question. So the oxytocin spray or the troche
Uh-huh.
is, so let's just take this patient we're talking about. So she's using that daily, like a daily thing when she wakes up in the morning. So not
Yes.
associated with, oh, I'm going to have sex, so I'm going to do this. So it's mainly like a daily thing she's doing, like you do
Yes.
hormones, like you put your cream on. So it's a daily troche for, is that how it works?
It's a sublingual tablet. Yes. I always recommend that you take it daily
Okay.
just to lower that level of anxiety every day,
Mm-hmm.
because you also, in case you want to have spontaneous connections, right?
Mm-hmm.
But you take it every day. And if you intend to have intercourse later that night, then take an extra 30 minutes to an hour before intercourse. That
Okay.
helps out a lot as well on several facets. And also in boosting that libido, but also boosting, the intensity of an orgasm.
Okay, great. And we also have men using, what are the men using?
Well,
The
with some of them, we have on oxytocin nasal spray to increase libido.
Mm-hmm.
But otherwise, what we have for men is basically testosterone creams or injections. But I like creams a lot because it's easy to adjust for patients, and it's they don't have to give themselves a shot every week or so. I think those are the two things
what
that
else for men are you doing right now that we should know about or our listeners should know about?
I mean, for men, they're pretty simple, easy to get, right? Easy to treat. And so the testosterone does the job pretty well. And some of our men, like you said, they use the oxytocin right before intercourse just to boost their orgasm. I think I don't we don't develop that many
Mm-hmm.
sexual health products for men because they they have a pretty good arsenal already. For hair, on the other hand,
It's
we have a
my
pretty good
next subject.
arsenal.
Absolutely.
Oh yeah, let's move on to hair because that's a
Absolutely.
big thing in our office right now.
Right.
Is hair growth.
That's a big one, right?
Yeah.
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 Mm-hmm.
So for hair, we developed this product about 10 years ago called ProCap 4. And this product was developed because of the success of Propecia or finasteride, right? Oral Propecia, oral finasteride works really well. What it does, for our listeners who don't know, it blocks the conversion of testosterone to DHT. Therefore, if you have less DHT is the agent that miniaturizes hair follicles, that causes hair follicles to get smaller and smaller, therefore produce a thinner and finer hair to a point that it won't produce any hair at all. So finasteride blocks that. The problem, though, when you take it orally, you get a side effect systemically, is that you can have side effects of gynecomastia, depression, even semi-permanent to permanent loss of libido. That's because men need DHT too, and you don't want any of those side effects, especially that loss of libido. It can be pretty permanent. I remember we had a 25-year-old who was on the oral finasteride, and his parents came in and was like, we need to get him something because he's 25. He should be interested in sex, but he's not. He's depressed because he can't connect with people on that front. And then he's losing his hair too. So that's not good either. So then we developed topical finasteride where you can apply it to your scalp without it being absorbed systemically. But then we saw that it worked really well. So then we decided to amplify it with extra ingredients. So now our ProCap 4 has 4 ingredients in it. The star is the topical finasteride. And then we have minoxidil in there as well, which is your generic Rogaine.
Mm-hmm.
We also have tretinoin in there as well. It's like your retina A. And then we have beta-methasone in there as well, a steroid, a very low-dose steroid. And all of them work together synergistically to help boost hair growth and reduce hair loss.
Wow.
And that has been worked really well for our patients for the last 10 years.
And people go on it and they use it. Can you see it like after you put it on? Like, do you use it in the morning or at night, or what do you recommend?
Yeah. So for women, I recommend applying at nighttime because the only way we can make the formulation to be stable, it has to be in like it's a little bit greasy. The formulation is a little bit greasy. So for women, I recommend applying it all over the scalp at night, rubbing it in, and in the morning, washing it off. Men, they don't care. Some of our male patients don't care. They apply it in the morning and it looks natural to them because some of them gel their hair and that looks all the same. But I've even had some of our female patients tell me that their nails grew a lot stronger because like they got on their nails and they just, when they were rubbing it in, it helped improve the growth of their nails. So I thought that was pretty cool too.
So if you're comparing something like this to, like, we sell a supplement in the office, Nutrafol. Are you familiar with that?
Yes. Mm-hmm.
Okay. So what should we kind of sell that down and just be doing a serum, or can they use it with that? Or
I recommend both.
But both,
right?
Okay.
Because the Nutrafol, what it does is supports the nutrients. It nourishes the hair follicle from the inside. You can't grow hair if you don't have the appropriate amount of nutrients in place as well. So that's important. What this product does, it just helps to make sure that there's the minoxidil, dilates the blood vessels along your scalp to allow nutrients to come in. So you can dilate your blood vessels all you want, but if you're not having the appropriate nutrients, your hair still won't grow. So that is the Nutrafol, and having a good diet is a foundation to having good hair. Also, lowering inflammation, reducing toxicity.
Right.
All those other wonderful things.
And then people have to stay on it though, right? So it's like hormones. You have to stay on it. If you go off of it or you run out, you're like,
If there was a cure for hair loss, we'd be billionaires if we could figure that one out.
I know. Or
there is no cure.
Yeah. Oh my gosh. What's coming down the pike at Harbor Compounding? What's sort of new that you could talk about that you guys are working on? Is there anything like you're excited about, super excited about right now?
Yeah, well, we are constantly developing, first, our hormone replacement therapy formulations is our bread and butter,
Mm-hmm.
right? And so
Yeah.
we're always improving upon the formulations to help it absorb better, help it, just work better for our patients in a less, inconvenient format, right? So, for example, if you're taking capsules, we try to make a solution, or oral solution that um, can reduce the capsule volume that you're taking. That is in the works.
Mm.
Um, I'm not sure if you're familiar with a lot of our gynecological preparations, but that has been uh, that's something that we're working on as well.
What do you
We're
mean when you say that gynecological preparation?
Yeah. So, for example, a lot of patients who have pelvic pain, they always, what are our options? We're making baclofen, a baclofen vaginal cream, or with amitriptyline, or with lidocaine, or a combination of, single ones, or a combination of all three, for our patients who have any type of pain,
Okay.
vaginal pain in that, you know, vaginal or pelvic pain.
Okay.
So we're always looking into formulations that are backed by clinical studies. And so we're looking more into a product for libido for men as well. But we have to see if it'll work.
Mm-hmm.
So we're always looking on that
What
front of
about,
us. But go ahead.
I mean, oh, God, I feel like the main question we get all the time, and we use Imvexi, we use Interosa.
We're using estrogen vaginal
Okay.
creams, which
It's
Yeah.
it's never easy, I'll tell you that, to get patients things through their insurance. And honestly, I hate the process. What does Harbor Compounding do for pain with intercourse, vaginal dryness, pain with intercourse? What type of product do you have?
So the estriol vaginal cream is our number one product for helping building that boosting vaginal lubrication,
Is it
because
messy?
what it does is it boosts the vaginal epithelium, right, which will help increase more lubrication. Now, if patients are averse to using any type of estrogen cream, we also make a DHEA vaginal cream as well, and that oxytocin vaginal gel that I was referring to before. Those are other non-estrogenic options that are available for our patients. And the estrogen vaginal cream and the DHEA vaginal cream, they run about like $65, $60 to $65 a month. The
Oh, that's not
oxytocin vaginal
bad.
gel is about $110 a month, because
And
it is a bit more expensive to source that chemical, that product oxytocin, than
okay.
your estrogen or DHEA.
Are
this
these messy? Are they messy? How do they put them in? It's a cream. So explain
Mm-hmm.
the process of how are patients using it and when?
Yeah. So the estrogen and DHEA vaginal cream, the dosing frequency generally is every day for the first 2 weeks, and then afterwards, like 2 to 3 times a week thereafter. And we fill it in like a toppy click, which is kind
Okay.
of similar to a deodorant stick with like a little
Mm-hmm.
aperture on top. But then what's pretty cool is that there's an applicator that attaches to that top of that deodorant stick, and you just click it into the applicator. There's no like tube where you squeeze it into the applicator and things are just leaking everywhere. This device is much cleaner, and it's much more accurate for dosing than a tube and applicator. And I haven't hear of patients complaining that it's messy. Um,
that's
I've
a
heard patients like it more than a suppository,
mhm.
because generally with a suppository, if patients have vaginal dryness, inserting a suppository that is not lubricated, is kind of dry, it can cause further lacer or exacerbate the micro lacerations that are along their vaginal tract. Versus a cream, it's much easier to tolerate that than a dry suppository.
Now that's a fairly recent change with the application, right, of the vaginal estrogen, because we've been using that with you for quite a while. And I think it was about maybe 2 or 3 years ago you changed to this method.
Yeah.
Yeah, right.
A lot of patients have commented it was so much better. So we just made
Yeah,
the switch.
I know that I've been prescribing that more now, even though there are more products on the market of estradiol vaginal creams, you know, in the 15 microgram strengths. They're still expensive for patients unless we use a compounding pharmacist like yourself. And that's, I mean, a lot of people want to use their insurance if they can, but it's such a headache to get that through because it seems like they have to have tried Premarin first and then maybe estradiol, vaginal cream, and with the applicator, the full gram that's being used, and it's messy, and patients don't like that. So the Vagifem and Vexi and Uvafem and being really the most convenient ones to be used. But again, it's so difficult to get those through authorization for the patients, or they're faced with a $300 a month bill.
Wow.
So I've been using your product more for my patients more recently, and also doing the DHEA option too, because there's a good product on the market of Intrarosa for DHEA, but again, it's really hard to get it through the insurance companies.
Yeah, we waste a lot of time
Absolutely.
in the process that I really feel like we should just start doing this, Duncan.
Yeah. I knew you'd say that.
I know. So now I'm like wanting to call the office right now. Excuse me while I call the office. Yeah, because it's so much time. So what's the turnaround time? Let's say a patient comes in tomorrow and they want this. What's that turnaround time? As long as they answer the phone when you guys call.
Oh, yeah, I have to always tell them 949. Don't
pick
ignore
up the
them.
phone.
Okay, it's not a marketer.
And actually, is that the way you get in touch? Is you call, or do you ever text, or what is that?
We do all of the above.
Okay.
We call, we leave message, we text, and we email.
Okay.
So,
and then if they pick up the phone, what's the turnaround time for something like that?
1 to 2 days if we have it in stock. Most of the time, we should have it in stock.
Okay.
If it's DHEA, like 10 milligrams per milliliter, or estriol 0.5, 2, 3, 10 milligrams per gram. And mind you, I mean, I know that, so remember, compounding pharmacies, we can't make anything that's identical to what's on the market because, the FDA has approved certain drugs already, proved it safe and effective for, using clinical trials that is effective for patients. So we can't necessarily make anything that is the same but cheaper for patients. But what we've done is that, the Intrarosa is a suppository, and we intentionally made our DHEA, our vaginal DHEA, a cream because patients have complained about the suppository. And then for the estrace vaginal cream, the one you were talking about that can't get covered by insurance, we don't make a lot. We don't compound a lot of estradiol vaginal creams, to be honest. We compound a lot of estriol vaginal creams.
Right.
Because there's a ton of studies showing estriol to be extremely effective in vaginal lubrication, vaginal atrophy, and used in urinary incontinence as well. And with minimal side effects of like building building that lining and causing patients to spot or having vaginal bleeding.
Right.
So that's been our estriol vaginal cream is a great alternative if they can't, utilize the estrace vaginal cream.
In your experience, is the estriol vaginal cream as effective as the estradiol vaginal cream?
Yes, as long as you dose it correctly, it is as effective.
Okay, good to know.
Mm-hmm.
Other things that we get from from compounding pharmacies are pellets for subcutaneous use for hormone replacement therapy, particularly estradiol and testosterone. Do you? I don't think you provide those, do you?
Yeah, unfortunately, at this moment, we do not. That would require a sterile compounding pharmacy.
Hmm.
And, I think it was 5 or 7 years ago, we had a sterile compounding pharmacy making pellets and sterile formulations, sterile nutrients, sterile hormones to be injected, eye drops. It was so fun. We had the whole arsenal of, at our hands. But with sterile compounding pharmacy, if you think compounding pharmacy restrictions have gotten extremely stringent with sterile, it's been extremely difficult to be able to comply with the laws and regulations that are set by the boards of pharmacy and the FDA. So that's why you may have noticed if you're looking to get any pellets or IV nutrients or
Hmm.
any type of sterile injectable right now that's compounded, you'll be hard pressed to find a sterile compounding pharmacy that can service you because so many of them have shut down right now.
Yeah.
We had to pull out of it because, it was not financially um, sustainable for us. And we knew our bread and butter was in the non-sterile pharmacy business or the non-sterile compounding business. Non-sterile meaning the creams and capsules and troches that we make that doesn't have to be sterile.
Right. So
I'm always looking for a good one. So if you ever to refer patients to, so if you know someone, let me
yeah,
know.
yeah, absolutely. Just quickly, a comment about troches.
Yeah.
Um, we used troches for a while. We have a few patients still using them. A couple of problems that one, the theoretical one, and the other one was a practical one. The theoretical one was some of that is getting swallowed, for sure.
Yeah.
And that's what
Hmm.
we're trying to avoid, is it going first pass through the liver. So I'm less inclined to prescribe that, the delivery that way. The second aspect is the uh, the the speed at which it is absorbed, which is great for some medications, but with hormones, you're getting peaks and valleys of
Hmm.
this. And so doing it once a day, you're getting this either peak at night or in the morning, whenever you're doing it, and then it's going to go way down again. Um, I'm not sure whether that accomplishes what we're really trying to accomplish with hormone replacement therapy, if it's, here 1 minute, gone the next. What do you think about that? But just because they are really absorbed quickly.
People
they're
like
just,
the troches. I
yeah.
liked them. I used them for a number of years. Now I'm back on the creams. I always
Uh-huh.
felt like I was baby swallowing, because you can't help that your mouth waters, first of
Yes,
all.
exactly.
So,
Yeah.
yeah.
I get it. I get the convenience of the troches. And you're right, Dr. Turner. You're right that a portion of it, a large portion of it, is being swallowed. And what we know, progesterone's fine to swallow and to pass through the, liver metabolism because its metabolites are beneficial and sometimes, just or neutral, right? But it's estrogen and testosterone that I'm most concerned with when it comes to liver metabolism because the metabolites, when it's exposed to the liver, it just stimulates the liver to make a ton of, increase clotting factors and increase any type of cardiovascular risk for patients. So the, I recommend always to our patients is if you can try the creams or a patch first. And if you can't, because you have children that you can possibly transfer the hormones to using creams, or you take care of infants, you're a caretaker, or if you have small pets that, you know,
Mhm.
are that if exposed to creams, they'll have adverse side effects, like
Yeah.
they'll lose their hair. If you can't use a cream, then use a patch. But if you use a patch and you're allergic to the patch, and you know that adhesives in the patch are pretty they're very irritating. If you can't use the patch, then the better of the two evils is to use something orally, like a troche or a capsule, versus having no hormone at all.
Right.
So the last resort is just to use something orally, better than having no hormones.
Right.
So I agree with you on that.
Good. All right. Okay. I want to go to your fun fact.
What's my fun fact?
Your fun fact is
You're a
that you're a snowboarder.
Oh.
And you have this dream. And my answer to your question there, and the question is for our listening audience, you've had this dream always of jumping out of a helicopter onto a pure white virgin snow
Do it.
powder. My advice is absolutely do it. And because I'm not a snowboarder, but I have skied and I have helicopter skied in British Columbia. And in fact, I don't think I've skied since because once you've done that, there's nothing better. And either you keep on doing that because you don't want to go down and deal with lifts and that type of thing. So being with a group of friends and helicopter skiing. Now, we weren't jumping out of the helicopter. The helicopter would put us down and then pick us up. We'd ski down, then it would take us up again to another mountain and go back down. But you could, as a good snowboarder, you can jump straight out of it. It's perfect. So absolutely.
That was in my 20s. That's my dream in my 20s.
No.
Do it.
No, you got it. You should still be doing that. Seriously.
Well, you know what? I know I can possibly still be doing it if I'm on like really good, hormones when I'm like
exactly.
50. After my kids are grown, they're
Right.
in college, and then that'll be a cool mom. I'll be jumping out of the helicopters.
that would be great.
But yeah, snowboarding is like my favorite sport. I was telling my son earlier today. It's so funny we're having this conversation, and I was like, "What sport would you want to, play?" Because he's playing lacrosse, football, and wrestling. And he's like, "I think I'd like to play lacrosse and wrestling." And I was like, "Yeah, because if you play football 4 hours a day every day, I don't know if you'll burn out." And he's like, "Well, what sport will you play, Mom?" And I'm like, "Well, I would be snowboarding every day if I had 4 hours a day, every day to snowboard." And all our kids are avid skiers and snowboarders. And my little one, my 4-year-old, she's the last one that I'm going to teach. And once that's done, we're all going to be helicopter skiing together.
Remember, I told you, okay, you've got to do this.
That's too funny.
Just so great to have you talking to us on the Vagina Doctor podcast. Thank you very, very much. It's been
I'm
really
going to be
educating.
Making some changes today on some things.
She's going to go straight
So
to the
I'll be
office.
emailing you later, actually.
Thank you.
Thanks.
Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.